An exercise for knee pain. The muscles get tired and as a result, they don't pump enough synovial fluid here, so osteoarthritis develops, meniscus tears can occur, and the joint surfaces start to wear out even faster than usual. This exercise is especially suitable for people with knee osteoarthritis and meniscus injuries. The amount of synovial fluid in the joint itself increases. You'll need a simple, versatile loop resistance band like this one for this exercise. Hello friends, as always we're on the Healthy Rook channel. My name is Maxim Mamchur. I'm a physical rehabilitation specialist and I'm also the founder of the Healthy Rook Kinesiotherapy Center Network. Friends, today I want to show you one of my favorite exercises and teach you how to do it. An exercise for knee pain. This exercise is suitable for knee swelling, knee joint osteoarthritis and meniscus injuries. So be sure to watch until the end. I'll explain the theory behind this exercise and then show you how to do it in practice. You'll see just how effective it can be for you. Let's get started. So, friends, I know you don't enjoy theory in general, but still, practice doesn't work without theory. You need to approach this consciously, so don't switch away. Watch until the end. This is 50% of your recovery success. It's important. Let me explain. Imagine this is our knee joint. I'm not a great artist, but I'll try to explain it to you now. So this is the femur and this is the shin bone. There should be a noticeable gap here between these two bones in the knee. What actually creates this gap? It's formed by our menisci and by the amount of synovial fluid that enters the knee joint itself. What is synovial fluid? It's a lubricating fluid, known as synovial fluid, that prevents the joint surfaces from increasing friction against each other as they move. When the amount of this essential joint fluid becomes low, that is, when it decreases, friction in the joint increases. Accordingly, the joint surfaces start to wear down more quickly. We develop osteoarthritis, which means the joint surfaces become rough. In addition, we may also develop age-related meniscus tears as a result. Not as a result of injury, but due to aging. This is also essentially a tear of the joint surfaces, because the menisci are joint surfaces. Accordingly, the space between the two bones decreases. These bones start to rub against each other even more. You might ask, why does the amount of this fluid decrease? Let me explain. Because the muscles that run along our legs are not working well. They don't pump enough fluid into the joint itself. Or if there is a functional pelvic tilt and a person spends their whole life putting more weight on one side, meaning one joint is loaded more than the other and the other less, in the same way, the muscles get tired, they don't pump enough synovial fluid here, the pressure on the joint surfaces increases, osteoarthritis develops, and meniscus tears occur. And even in some cases, when there is severe compression, these small bulges appear, usually under the knee, which are called Baker's cysts. What is that? When the knee compresses the synovial membrane, that is, a kind of sac filled with synovial fluid, it pushes out a bulge of this synovial fluid to the side. This is called a Baker's cyst. Now that you have a clear understanding of the theory, let's move on to a practical exercise that you can easily do at home. For this, you'll need a small piece of resistance band, which I will show you a bit later, so please don't switch off and make sure to watch until the end. You'll need a simple loop resistance band just like this one. You can buy it anywhere at any sporting goods store. What do we do with it? Let me show you. I carefully and securely attach the band to the leg of, let's say, a sofa, pull it so there's good tension, hook it onto my leg, and then lie down, or rather, sit down in a semi-reclined position. I straighten my leg, the band should stretch my joint as much as possible, and the leg is resting. I pull my knee toward my chest, making sure to really focus on bringing the knee to the chest. 1. Return to the starting position. The band stays under tension the whole time. I want to draw your attention to that. 1. Pull back to the starting position. 2. Back to the starting position. I'm working, feeling how the front part of my thigh and my knee are engaged. 3. Back to the starting position. 4. Back to the starting position. Do 15 to 20 repetitions just like this on one leg, making sure to maintain good form throughout, and then repeat the same 15 to 20 repetitions on the other leg as well. If that's not enough for you, you can increase the number of reps to whatever your current physical ability and comfort level allows. After completing the exercise, you should feel warmth in the front part of your thigh and around the knee joint. What will happen? The body will pump fluid as much as possible, the muscles will pump fluid into the knee, and as a result, the amount of synovial fluid in the joint itself will increase. But now we need to get rid of the stagnant fluid from the joints. What are we going to do? I take a cold compress and gently apply it to the knee. You can do this either over your pants or with a very thin piece of fabric, such as a bandage. I carefully apply the cold to the knee through the protective fabric bandage. I hold it in place for about 15 seconds on one spot, then another spot, then a third spot, but I don't put it under the knee because there are lymph nodes there. In this way, the blood vessels throughout your body will constrict, gradually pushing out all of the fluid, and the body will recognize that the vessels have closed and will then need to begin warming up. Again, a lot of new, fresh, restorative fluid will be delivered there as much as possible. This way, we will achieve a restorative effect. Use this method. Don't be afraid of catching a cold. 15 to 20 seconds won't make your knee cold. Friends, I sincerely hope you liked my exercise. Please be sure to write in the comments how you felt about it. If you haven't subscribed to my channel yet, please do so, and also hit the bell so you're the very first to know about new videos. Additionally, scroll down in the feed and you'll see just how many useful and informative videos and exercises there are for a wide variety of musculoskeletal disorders. Stay with us on the channel. See you soon.